So, good afternoon to everybody. I'm Carlotta Martini from G-Spine 4, and I'm going to interview Dr. Pedro Berjano about science and spine surgery. So, Dr. Berjano, good afternoon.
Good afternoon.
How are you now?
I'm fine. This is a great meeting, great congress, and I think we are going to learn very much from our colleagues from all the world.
Okay, thank you. But my very first question about science and spine surgery are mainly three. I'm starting from the number one. In your opinion, so according to your experience, which are the three main problems of a very green spine surgeons who starts to do research?
Okay, it has been a long time since I was a young spine surgeon wanting to introduce myself into research. But I think that the most important problem was to have a good idea. And that's because science starts with an idea that comes from experience. So my very first problem was to understand what to do research on. I didn't have a large knowledge background. I was not into a group with a large research background. So it was very hard to get the right idea. How do you overcome that? Which is so the easiest way is to join someone with the experience. And in my opinion, people who are more advanced in their career, even not researchers, have good ideas, good problems to solve that can be an idea for research. So I think that's the first problem. The second problem is to know how to do research. How to do research is something you can build over time. You build it by doing, and you build it by learning, going to courses, reading, but especially by doing. When you solve a problem, you will learn how to solve it. You will learn what are the obstacles to do that. So, in my opinion, the three main problems when you are a young researcher are two: having a good idea, learning the methods.
Okay, great answers. Thank you very much. And what about your condition now? So you're probably in the middle of your career, so you have a big amount of active practice, a big amount of surgeries, a big amount of patients, and probably, I guess, no time. So what's the problem in your situation now doing research? So even if you have a lot of young people working for you and with you, what's your problem now?
You're very kind saying that I'm in the middle of my career, because probably I'm declining in my career now. But responding to your kindness, I think that you're right. When you have more experience, you have more things to do, you have less time. So many ideas, you know better the methods, and now you do nothing because you have patients knocking at your door. So what to do in that period? Probably there is not a good recipe for everyone, but for us, what has made the difference has been making a method and making an organization. So if you are able to attract people and at the beginning invest your time in having them learning how to do and running their projects, and second step, you set up an organization, which is a method. How can do research? We meet once a month to see what are our projects. Okay, how do we start our project? Maybe the way is writing the abstract of what would be the finalized research, and so on. By creating a method and by giving tasks to your team, you can improve your ability to translate your ideas in your team's group, in your team's work, and that gives you a result.
Okay, great. Thanks a lot. So, following the line, I'm going to ask what will be the problem for someone who is at the end of the career. So, probably the chief of the department, I will not do names, okay? So I'm talking about someone in general, but someone very skilled, someone who is the chief and who has a lot of people and a lot of experience, and that probably has a lot of answers, but that is not already satisfied.
That is nice, because when you talk to me about these 3 periods of your life, in fact, it is like this. When you have a good organization that can make papers, you realize that what you want is relevant research. And relevant research is a professional work. So you need money to train people, to pay for people to do research, and for paying the cost of research. So I think that the biggest challenge at the most mature part of your researcher career is being able to attract financing. That means to be competitive for grants, to be competitive for trials offered by the industry, and that's what you can be by having a team that has a method, that has a background, a credibility built on the results. And so you can achieve that. But it's very, very hard, it's very competitive. So the main problem is getting money. And I will give you a 4th answer. I know some people who are over that period of their career. They are able to get money for research and relevant funds. And for those, the nightmare is handling the money. So you have the money, you have to administer that, you have to make accounting, you have to make reports, and then you were a researcher and you become an accountant. That's the challenge, keeping your mind fresh when you enter in that declining, or maybe young, if you are luckier, part of your career where you are able to attract massive funds for research.
Thank you very much, Dr. Pedro Berjano, and thank you everybody.